All right, good afternoon, everyone. We are going to get started here in just a few minutes. Just want to give you all a little bit of information. I want to thank you so much for joining us this afternoon. My name is Paula Hyman. I know it says Victoria. I'm sitting in for my manager, and I'm from the Ohio LTAP Center. On the line here, we have Judy Shanley and Jerome Tunison, and they are going to be presenting the mobility management activities across the nation amid COVID-19 presentation for you all today. I'm going to ask that you all remain on mute during the presentation as we are recording this. If you have questions during the presentation, then please submit those into the questions box. It's very important that you put those into the questions box and not into the chat, because we will be just following up with any questions that may go unanswered via email afterward. And if they're in the questions box, then they are recorded. Hopefully everyone can hear. If you are having any troubles with any audio or anything at any time, you have the ability to raise your hand and we will attend to you. All right, so I'm going to hand it over to Judy. Judy?
Terrific. Thank you. Thank you, Paula. Thank you for inviting us. Thank you to you all for attending. We're thrilled to be here. Hopefully my name is recognizable to some of you. I've been involved with the Ohio Mobility Management Network for a number of years now, working at the National Center for Mobility Management, Easter Seals. So we're really happy to join you. When Olivia and I started talking about this webinar, we were talking about national strategies, but then she was talking about all the terrific work that you were doing with connections with emergency management EMS services. So we're going to be talking about some national things that we've learned through the National Center for Mobility Management, but also we are going to be specific with sharing examples of how mobility management organizations and professionals have worked with EMS or emergency management services around the country. So if I could get this to move, we will be good. So hopefully you all know about the National Center for Mobility Management. We call it NCMM for short. We're a National Technical Assistance Center, and we were started in 2013. So we're moving into our 7th year, believe it or not. Just amazing to me how quickly time goes. We are a collaboration between 3 national organizations, Easter Seals, which is where Jerome and I are from, and the American Public Transportation Association, and the Community Transportation Association of America. And really our work is on supporting states and regions and even local level to some extent to build coordination and mobility management networks. And we're funded by the Federal Transit Administration. So a large part of our work focuses on building those partnerships that are supported by the FTA's work around the Coordinating Council on Access and Mobility. So just a little about me. I'm by background a vocational rehab counselor. I worked for a number of years in private and nonprofit settings. I worked in ARC and UCP and typical kind of employment and workforce settings like that. And then I got my degree in special education and I focused on youth transition. And always in my work, I was frustrated because we talk about all the exemplary practices and best practices to facilitate employment outcomes and post-school outcomes for youth. We talked about how important health services were and other social services, but no one was ever thinking about transportation. So I had an opportunity when I was at the U.S. Department of Education in DC to work on the initiative, what was then called United We Ride, which was the effort to bring 11 federal agencies together that focused on transportation. So I tell everybody, and those of you who've heard me speak probably have heard me say I have the best job in the world because I get to combine my background in rehab and human services with transportation and mobility. And really, if you think about it, that's the role of a mobility manager. So I'm fortunate to work with a really bright young man. And Jerome, I'll let you introduce yourself.
Thank you so much, Judy. Hi, everyone. For those of you who don't know me, my name is Jeromes. I'm a project associate with Easter Seals in the National Center for Mobility Management. I serve as NCMM's regional liaison for FTA Region 4 and 7. So 4 being the southeast of the country, southeastern states, including Florida, Georgia, Kentucky, North and South Carolina, and others. And then Region 7, which is the MINC states, so Missouri, Iowa, Nebraska, and Kansas. And while I don't serve Ohio directly, I've heard a lot of good things through Judy's work with you all, and look forward to sharing some examples about emergency management services and how mobility management can facilitate coordination in this exciting space. A little bit about me. I'm a world traveler. As the slide shows, I spent last year conducting a fellowship studying the role of transportation and quality of life in different cities around the globe through a university fellowship. I graduated from Vanderbilt University in Nashville, Tennessee back in 2018, and had the great privilege of traveling to study and meet with transportation professionals, nonprofits, governments all around the world to look at how transportation impacts quality of life and it makes it easier for us to get from A to B. So now that I'm at NCMM, I'm really excited about looking at this from a perspective, a national perspective and international perspective. And if we can go to the next slide, Judy can tell you a little bit more about what NCMM does and if you've used our resources. Judy?
Yeah. I live vicariously through Jerome and his world travel experiences. So how many of you have used NCMM resources? I guess we could put it in the question and answer or the chat. Just let me know whether you've ever used our services, whether you've received technical assistance from us.
Judy, I see about 3 hands raised, but if you can, okay. Everyone in the attendees can raise their hands with the raise your hand button. We see now, yeah, that's increasing to 8, 9. Yay. So still, several of them have.
Wonderful. That's just a little about NCMM. The services we provide are really customized to states. We're free because we're a National Technical Assistance Center. And this slide that you see, this cartoon on the screen, the caption reads, "What if we don't change it all and something magical happens?" Well, we all know that often things don't magically happen, that we have to do something deliberative to change. And that's where technical assistance comes in. And that's where the work that you all do as mobility management professionals, transportation professionals in Ohio, you really are the magic to help things change. Olivia had initially talked to me about some of your work with EMS professionals, emergency management systems in your community. Again, can you either raise your hand or put in the chat box whether you're currently working with EMS? I can't see the chat or the hands, so that's why I'm asking Jerome to kind of report
it's
to
like
me.
We have about 11, so 30% of the attendees at the moment.
Yay. So I would love, as we move into talking about specific activities that we've seen nationally, I would love to get your feedback regarding how you're specifically working in your communities. You know, this is a real opportune time. The COVID-19 crisis has really solidified why it's important to have relationships with emergency management. One thing that this pandemic has done, it creates people and resources to pool, to think about resource efficiencies, to think about the knowledge and the tools that our respective industries have. So it's a perfect time to form those alliances. I also recognize that you are experts in transportation content and the needs of marginalized populations. So, you know, all of those individuals with disabilities, those who are low income, older adults, you have the knowledge bank, you have the experience to be able to offer our colleagues in emergency management services and offices at the state and local levels, the content about implications of varying disabilities, sectors, what are their needs, what are the human services organizations and the resources that you can align with that can help EMS populations. And ultimately, you can support the notion of no citizen left behind by forging these relationships. It's also a good time. I mentioned that our work, the National Center for Mobility Management, supports the Coordinating Council on Access Mobility. We call it SECAM. For those of you who don't know, SECAM has been around since 2008, and it's the effort by the Federal Transit Administration to lead work to coordinate transportation services across these 11 agencies. So having the secretaries and the programs affiliated with HHS, the Department of Education, the Department of Labor, the Veterans Administration, etc., working together to ensure that all of the populations that are the target audiences for these federal programs have the transportation services they need. And if you haven't been to the FTA CCAM website, go to it, because there is something that we call a program inventory. Let me see. I didn't include the program inventory here, but the program inventory includes over 130 federal programs. So it's all of those grant programs across those 11 agencies that either can support funding for transportation, can provide transportation directly, can support voucher programs, and you could search it by federal program. So in your community, if you know that you have a grant from the Administration for Children and Families or the Administration for Community Living, you can search to see whether that grant can pay for transportation. And many of those programs can be used as a match, especially in the 5310 program, the 80-20 split. So look at that program inventory, and I'm sorry I didn't include it on the slide. We can send it out after, but it's a really good way for you to knock on the door of those administrators of those projects and say, hey, I know that you can support transportation through this grant program. With all of that said, whether it's coordination during COVID-19, it's coordination under the auspices of the CCAM work, there are challenges, and you better than anybody know the challenges. We're turfed. We have turfism. We have our roles, and sometimes it's hard to go beyond that role because of time, because of political, because of philosophical differences, and sometimes the roles are blurry. We also use different language. The acronyms that are used in EMS mean something completely different in our world. I remember coming from the human service side, and I would talk about APTA, APTA. Well, in the world that I came from before my role in transportation field, it was the American Physical Therapy Association. Well, in our world, it's the American Public Transportation Association. So we all use different languages, and we're all busy, busy, busy. Coordination takes time. It takes a lot of effort. It takes kind of finagling. It takes finding the ROI, the return on investment, for audiences that we collaborate with. And there's also the feeling sometimes that someone else will do it, that, okay, I won't do it, but I know it's going to get done. But it's not magic. And so sometimes that doesn't always happen, and we have to be the magicians. If you think about EMS and you think about the role of mobility managers, EMS professionals, their primary role is that to ensure that all citizens in the community have vital transportation in emergencies. That's part of their role, is that people access the services that they need in spite of emergencies. They also they need support regarding accommodations and communications. EMS professionals don't traditionally have training in disabilities or the implications of varying disability conditions. And so one of the things that we could do as mobility managers is help inform them about if a person has a particular diagnosis, they have particular needs around XYZ. We also know the organizations and the providers that are trusted by individuals with disabilities or older adults, and we could serve as a liaison between EMS professionals and those organizations. And then finally, we know that in emergency planning, similar to transportation, EMS organizations have the need to develop coordinated plans. They have to have everybody at the table, just like we do with our coordinated planning process. Well, we are in a position as mobility managers to help get those human service organizations and those individuals with disabilities and older adults to the table, to the coordination process, so that as plans are undertaken, that people with disabilities and the organizations that represent those individuals are at the table. So if, looking at this, there is really clear alignment between what EMS needs in crisis and beyond crisis and what we could do. So what can you do? And I'm suspecting that many of you do these things already, but getting to know who your EMS colleagues are and inviting them to meetings. Are they, Jerome and I are going to be, Jerome's going to be talking about what we learned when we reviewed some coordination plans, but if you look at your community regional coordination transportation plan, is EMS part of that plan? Have they been at the table when you're doing the planning? And conversely, it bothers me, but EMS has their own separate plan. Are we at the table with their plans? Are we written into their plans in some substantive way so that during emergencies and beyond we have a role? And this is the second bullet, looking at the emergency management plans and look for opportunities to integrate. This world would be such a better place if communities had one plan. I mean, you all know there's a plan for health, there's a plan for education, there's a plan for labor, transportation has a plan, emergency management has a plan. So we need to get all our plans consistent and aligned. And then, as I said, look at your human service transportation plans, look for opportunities to integrate. You can be the catalyst for ensuring that people with disabilities and older adults are at the table. It also may be that EMS, our emergency management colleagues, need demographic data or incidence data, prevalence data. And because we're so close to the field and riders and different populations, we may be in a really good position to provide those kind of data to our EMS colleagues. I've said this before, helping EMS understand the functional and communication outcomes for varying populations. So, someone has cerebral palsy, someone has a cognitive disability. What does that mean? And I know that, a label doesn't define a person, but you all are so understanding of the diversity of individuals that you could help EMS professionals understand what that means in real terms. In real terms that help them during a crisis. Also sharing information about health and helping organizations. You are connected to all of those organizations in your community and the service providers, so you can be that liaison, that intermediary to share those examples. Also, EMS professionals often are in the position of developing asset inventories in communities, so they want to know kind of what are the hard and the soft assets that a community has that need to be considered in emergencies, and you can contribute to that process. The other thing is being part of planning and tabletop exercises. I don't know if many of you have heard of the term tabletop exercise. That's where emergency management professionals sit around a table and plan scenarios. What happens if there's an earthquake? What happens if there's hurricane? What do we do? What's everybody's role in that? And there's a emergency preparedness training that was done. I think it was in, we have a resource in Oregon, but this was in the Mass Transit magazine, and it's a really good overview of training for EMS professionals about disability and transportation. I thought that might be useful to you. Specific to EMS, I'm going to turn this over to Jerome and share with you kind of what we learned when we reviewed a national landscape of specific strategies and programs. Jerome?
Thank you, Judy. And today I'll be talking a little bit about the history of 211 and 511 and some examples of how these services and EMS services have partnered with mobility managers in the past. So a little quick background about 211. In 2000, the FCC designated 211 as a 3-digit dialing code that provides public access to information and referral, primarily for health and human services across the country. So you'll often see that as INR. And INR services were developed to bridge the gap between human service programs and those who need them. And in the case of emergencies, 211 is also a key service. 211 providers often know the asset inventories that Judy mentioned. And so coordination is pretty common with 211 services and EMS services around the country. And over the years, 211 has become quite prevalent in many states, even reporting 100% coverage of their state for 211. And this presents a great opportunity for mobility managers, as Judy alluded to earlier, that mobility management and mobility managers provide a lot of symbiotic opportunities to share information and to have an effective means to obtain access to human services transportation information. On the next slide, I want to talk a little bit about how the FDA has studied utilization of 211 call centers as a viable part of human services transportation coordination. In their report titled 211, 511, and Human Services Transportation, the report states that 211 is a logical choice for a service oriented toward the transportation disadvantaged and others who are having difficulties meeting their basic needs. The report also states that the databases used by 211 services already include the vast array of small-scale, often informal transportation services. These database entries would be extremely useful building blocks for the development of the consolidated scheduling module envisioned by the then United We Ride and the Mobility Services Across America program, which was a 2008 program that funded coordinated transportation. Now, since this study was conducted, mobility management has emerged as the missing link, as the graphic shows, between the interfacing of 211 and 511 systems. Despite the lack of formal guidelines to define how this is done beyond referencing one another. And as you all know, this gray area of mobility management is what NCMM helps provide technical assistance for and ideas of how we can better coordinate these disparate services in our community. On the next slide, I want to talk briefly over what transportation providers are doing to fight the consequences of COVID-19. Today. So food by all definitions is considered essential, but for some populations such as seniors or others with underlying health and mobility issues, going to the grocery store can be added risk and carrying added risk among a spreading pandemic. So many transit providers in states such as Nevada, Texas, Iowa, Minnesota, and Michigan are working with local partners to ensure that food is delivered to those who need it. In this example, the Regional Transportation Commission of Southern Nevada is working with 3 Square to ensure seniors will have access to food through deliveries. Nevada is currently under a 30-day non-essential business shutdown, and the reduction in demand has freed RTC paratransit vehicles to provide food deliveries. In the next slide, this great article I found from Vice I'm sure many of you have seen this article now, and it underscores how, like their urban counterparts, many rural transit agencies didn't shut down when their respective states issued stay-at-home orders. The managers interviewed in the article recounted similar thought processes. One's reminiscent of the mutual aid networks that have sprung up around the country. And they asked themselves how they can still serve their communities, even if it means adhering to social distancing and putting their community first, personal finances second. So others are hoping that this crisis spurs more fundamental changes in how rural transit is funded, so they aren't scrounging for dollars every year to get that federal match, but it does a good job of driving home the need for transit even during COVID-19. And so this can be useful for working with peers in your community to underscore the need of transit and its services that it can provide. On the next slide, there's a few more examples that I will quickly breeze over. On the left there, in Lancaster, California, a Project Door Drop provides prepackaged boxes of food for the LA food band to the elderly and immunocompromised within the city of Lancaster, California. And the city says that one box is estimated to feed about 2 people a week. So this is another great example of transit being leveraged to provide vital resources to the community they serve. In the middle image, Central Ohio Transit Authority, close to home for you all, worked with local organizations to deliver 3,000 kid kits full of items to keep young minds engaged as parents have to grapple with working at home, but also keeping their kids educated and entertained. And then the third one, which gave me a chuckle, this example, in Oklahoma, the Pell Van Transit is also providing donated pet food in addition to in-home meals for seniors. And we don't often think about pets during this time, but they too are a vital support system during this troubling time. All right, and the next slide, I wanted to dive a little bit deeper into examples of how other parts of the country are embracing mobility management concepts to respond to emergencies. This example is from San Juan County, Washington, and it details how emergencies are included as a consideration in the locally developed Human Service Transportation Coordination Plan. So in the event of and subsequent to the onset of an emergency disaster condition, the Human Service Transportation Plan shows that the San Juan County Department of Emergency Management will convene objective-based planning coordination using teleconference and in-person meetings. And they have listed in the plan participants, including first responders, public works, non-governmental organizations, human services, and other providers and stakeholders related to the emergent incident or consequences of the incident event condition. So in the next slide, we'll dive a little bit deeper into San Juan's planned response. So once deemed necessary by the emergency, a member of Health and Community Services may be called upon to serve as a transportation branch director when participating as a member of a local incident command team. These roles and areas of responsibility are outlined in the County Comprehensive Emergency Management Plan, or CEMP, which are frequently found in, these are the emergency management plans that Judy alluded to earlier, and are further detailed in the county department's emergency or operations plans. Now, working within this structure allows assessment specific to the situation to best utilize existing resources, identify gaps at the time of need, identify existing resources available for sharing to address the need, and source outside resources if needed. So these resources may include programs, people, and equipment. And specific plans to identify where vulnerable locations, populations may be located in the event of a disaster, such as using existing senior services contact lists or NGO contact lists, including the list of Meals on Wheels and delivery addresses might be a way to see where these vulnerable populations live. You can also use client contact lists from existing NGOs or nonprofits in the county. And another creative example that was found in this report was working with the assessor's office or county GIS department for the list of properties and addresses which qualify for special consideration for disability or senior citizen tax programs. And then another great example is working with the local, within the limits allowed by HIPAA, to obtain information from local EMS, health department, and healthcare provider to locate residents with known special needs. So that's just one example, but on the next slide, another example of emergency management being integrated into long-term planning and readiness is HopeLink Mobility Management, which is also based in Washington, but this is in the Seattle metro area. And HopeLink provides staff support for the group called the Regional Alliance for Resilient and Equitable Transportation. And this group seeks to increase the critical transportation services available to older adults, people with disabilities, low-income individuals, and other vulnerable populations in the event of an emergency in the Puget Sound region, also known as RARET. RARET will increase the preparedness and the ability of special needs transportation providers to assist individuals with access and functional needs. And these methods often include technical assistance for providers, coordination across disciplines and jurisdictions, workshops and exercises to prepare, targeted outreach, and more. And some of the outcomes that they're focusing on is trying to create a sustainable network of providers, increase awareness of resources available in the community, enhance continuity of services, especially during an emergency, and truly whole community engagement. So some of the efforts that they're doing now include convening regional partners to identify opportunities for collaboration and resource sharing. They have built a network of transportation providers able to operate in an emergency and are keeping newsletters, updates weekly to ensure that this is a steady stream of information that's up to date. And the work group features diverse representation from emergency management, vulnerable populations planners, public health, transportation, human services, and community advocates from all over the three-county region, King, Pierce, and Snohomish counties. On the next slide, the website that they use is using a front-facing web tool to show the locations of cancer and dialysis facilities, and will be soon adding emergency manager contacts in the 3-county Puget Sound region. In addition to its website, like I mentioned, the newsletter is being used now to provide weekly updates to connect different organizations and support community needs. HopeLink has been sharing resources and funding opportunities in these newsletters to better support their partners. And finally, the last slide. Our example continues this West Coast trend here, but with the Mobility Management Center out of Santa Clara County, California. This is called Outreach Mobility Management Center, and they're described on their website as a nonprofit public benefit organization committed to the mission of supporting older adults, individuals with disabilities, and low-income families in their efforts to lead independent and self-sufficient lives. And related to emergency management, back in 2009, Outreach engaged with Caltrans in the 211 California Rural Mobility Management Planning Study, and they identified several tasks, including the identification of existing rural human service transportation providers, access to information referral and real-time transit, traffic, and transportation information, working with emergency services to identify service gaps in order to respond to the emergency preparedness needs of the elderly, disabled, and low-income individuals in these areas. Also, they really wanted to stimulate public participation through focus groups, stakeholder meetings, and coordinated plan documentation. And finally, find strategies for interfacing 211 call centers with mobility management concepts through technology. On the next slide, in addition to the partnership with Caltrans, which is the state DOT, the Outreach Mobility Management Center concept was implemented in partnership with the regional MPO, which was an important partner to have. And also, what makes Outreach's model unique is that it combines broad human services support activities within state-of-the-art transportation services and leverages cutting-edge technologies and custom software solutions to increase program efficiency and cost effectiveness. On the next slide, it shows the state's Mobility Management Center web portal, which is a one-stop virtual source for a number of transportation options and management tools for coordination. The MMC's web-based tools allow multiple entities to include their vehicles and drivers in a comprehensive fleet inventory system for coordinating in the event of a community emergency or disaster. Other data includes like a GIS mapping of at-risk individuals who will need transportation assistance in an emergency, the location of accessible shelters and evacuation routes, and links to emergency communication systems such as 211 and 511. So this and previous examples all together show how sound planning, collaboration, and even a little bit of use of technology can enable mobility management to serve people who need rides during times of emergency. I would now like to turn it back over to Judy to go over further ideas about how mobility managers and EMS can coordinate during and after COVID-19. Judy?
Thank you, Jerome. The example you provided about the transit agency delivering pet food was really amazing. And I think it just is a testament to how innovative, creative, and attentive transportation and mobility management professionals can be. When I think about coordination, I think about the on-the-ground stuff, the delivering the meals. I know of transit agencies that are serving as hotspots, having their vehicles serve as hotspots in areas where Wi-Fi is low. But I also think of these more macro level characteristics and considerations that really facilitate coordination between EMS and transit. And these considerations really can focus on coordination even after crisis. So implementing policy guidance across sectors. So having a policy that comes out of your state's EMS department that's aligned with something that comes out of your transportation department around coordination would be important. So developing those policies that could be sustainable. Cost sharing is obviously an important characteristic for coordination. If you're cost sharing the cost of transportation across different agencies, that's a real viable way to show coordination. Vehicle sharing programs are growing. We're seeing more and more communities where a church, a religious organization might have a vehicle and they're sharing it with a human service organization, might be sharing it with an employment service, so that not everyone has to buy their own vehicle, that there's a pool of vehicles that are shared across various organizations and purposes. Also, launch cooperative grant programs, and that this consideration is mainly addressed to state people that have the authority to develop grant programs. But why not develop a grant program that requires an applicant to have transportation or mobility management professionals involved? And conversely, why can't a transportation grant that comes out of a state also include human service organizations or grants funded by ACF or ACL? So requiring that in cooperative grant programs would be important. Sharing staff. We know that there are many, not many, I shouldn't say many, there are state agencies who the mobility manager coordinator at the State Department is actually a staff associated with HHS. For instance, in New Hampshire, they just hired a mobility manager type person, a transportation coordination in the State Department of Health and Human Services in New Hampshire. And her responsibility is transportation across all HHS agencies and working with transportation. So it's an example of sharing staff. This is similar to what I said with the grant program, including a focus on mobility and transportation and priorities and grants. Always when you have meetings and cooperative planning regarding a variety of topics, whether it's health, community service, emergency management, make sure that the group is a heterogeneous and representative of emergency management as well as transportation and the usual suspects of the human services. Develop performance measures associated with coordination so you can measure, you can assess, is it working? Are we doing what we hope to do in terms of coordination? Informational materials and agency resources, you could collaborate to develop, and some of the materials and the resources that I shared on the slides are indicative of that, where the mobility management professionals worked with the EMS professionals to develop training materials. Hold joint events and conferences and webinars. Do a cross-agency event that brings in the perspectives of the diverse audiences. And then invite partner agency personnel to serve on your review panels, or if you have a grant program and you need reviewers or advisors, think about these other agencies like EMS as a way to bring those perspectives into the process. We know, Jerome and I do tons of work around coordination across the country, and what we've learned, the variables that really create stick-to-itiveness or sustainability, or those efforts that are interagency and interdisciplinary. The coordination involves multi-modes, so it's not just thinking about one mode of transportation, it's thinking about the varying mobility services that might be available in a community, including paths of travel and complete streets and active transportation and all those considerations that allow people to move about in the community. The efforts are coordinated and efficient in terms of the process of doing it, so it's not labor intensive to coordinate. You're thinking about the process and trying to make it more efficient. The process always, the characteristics of coordination are always accessible and equitable for varying populations. And there's always the notion of thinking about the effort as being systemic, that it's going to affect change across all of a system, not just top down, not just bottom up, but across the whole system. So those are just 5 of the characteristics that we see when we look at coordination efforts around the country. This is one of my favorite slides. This is 2 young men standing on a snow-capped mountain, and the young man on top of the mountain is looking down at the gentleman on the bottom of the mountain, and it says, "Are you kidding, Billy? We climbed all the way up Everest and we forgot the freaking sleds." So never think about why we do what we do. The person, the individual with disability, the older adult, the person of low income, those are the people at the heart of why we do what we do. this is the Ride Connection, the Oregon resource that I think is a really good resource in terms of emergency preparedness and training. Our TA centers, respectively, across the FTAT centers are also a wealth of information. We've got on the NCMM website, we've got COVID-19 specific resources. We have specific resources regarding coordination, as does the National Aging and Disability Transportation Center. The National LTAP program has really terrific resources. The Shared Use Mobility Center has all things about shared use mobility, obviously, TNCs and Ubers and Lyft, and what are governance, what are partnerships. We've been lucky enough to do some products with them, so there's some materials that you can find on our website, as well as the Shared Use Mobility Center website, which talk about disability issues and shared ride mobility. And the new project that just came on board last year is the National Center for Applied Transit Technology. That's at CTAA. The arrows next to these centers are the national centers that have grant programs. We just announced, the National Center for Mobility Management just announced a planning grant competition. So I encourage you, sign up for the listservs associated each with these national centers as a way to find out about grant programs that will enable you to do some of this work related to COVID-19, but importantly, work that you could use to sustain the effort over the long run. So take advantage of some of the federal resources that are out there because they're all free. We'd love to hear your ideas, your questions. We'd love to learn about what you all are doing on the ground. And as I said, I'm having, I see some questions here. Is there one question, Jerome?
Yeah, Judy, we're seeing here a question about
insurance.
And,
Topic that we
get
a lot about. And I don't know, Jerome, if you want to say anything. What we could do is we could send that insurance document that we created for New Hampshire, because that has some of the national things. But what we learned is that the insurance questions are so state specific. The regulators in each state really decide or govern the insurance arrangements between TNCs and transit agencies. Jerome, do you want to offer anything?
Yeah, just that you have to be creative and flexible when it comes to insurance, and we've seen a number of different strategies, such as insurance pooling organizations among governmental agencies. For vehicle sharing, we've seen joint use arrangements have been popular in that, so that in these arrangements, the different purchasers of vehicles will have different cost allocation for the insurance premiums, and those costs will be shared amongst the program recipients. So it's just a matter of being creative and flexible. There's no one size fits all solution for insurance, unfortunately, and it's a very murky area, as Judy said. But we can definitely send that document out to folks who are questioning the insurance issue. It should not be a major barrier to coordination, and often it's misconstrued that the federal funds that are associated with transportation often indicate that insurance must be very set in stone when it comes to sharing insurance costs among providers, but it can be tackled in a creative way. So looking forward to sending that out to everyone.
And I'll just give you an example. I do a lot of work around schools and youth transition and bringing together school personnel with public transportation professionals so that youth have really good outcomes when they leave high school. And one of the questions that we had heard was, can school buses be used to transport people other than school children? And so the question was posed to the FTA, and FTA went to their lawyers across the agency that oversees pupil transportation. They went to the FTA organization, and it turns out that there is no federal restriction associated with using school buses. You can't not use a school bus for transporting kids when you need it, but after hours and after school, there's no reason why that school bus can't be part of a transportation network. So it's used to transport people to doctor's appointments or people to work. And that was just a misinformation that people had about the use of school buses. And we had done a survey on funding transportation nationally about 2 years ago, and we asked questions to various federal agencies about the ability of their programs to fund transportation. And the big thing that we learned is that people didn't know. People had no idea that their program could support transportation. That's why that program inventory that I talked about is such an important resource, because often it's us, it's mobility management type people have to go to these grantees in our state and say, hey, I see that you have a Children and Families grant. Did you realize that some of the monies of your grant can pay for transportation? Because often the program administrators of those programs don't even know that their program can fund. So insurance is the same way, that there's a lot of misinformation and perceived information about what a program or insurance coverage can and cannot do. And as you know, the pilot programs that FTA funds around mobility on demand and shared use mobility, as we learn more and more, we're starting to see much more being written about insurance. And so Jerome did a really great job of compiling that information for a workshop that I did in New Hampshire. So we'll be sure to get that to you. So are there other questions?
If you have any questions, please feel free to type them in the question box.
Well, tell us how are you working with EMS, with emergency management in your community? Oh, hear the on the ground examples. What Jerome and I love to do is when we hear examples from people like you, we like to take them and share them nationally and say, hey, do you know what they're doing in Cincinnati? Or you know what they're doing in, you know, in Columbus? Anything. Well, let me see, on this next slide, here's we are working with EMA to get mass distributed. Oh, hi, Leslie. Wonderful. Yay. Yep, that's, we've heard of transit agencies who are helping in the delivery of products and PPE, and that's critical and important. So yay to you. Anyone else? Well, after the fact, you know how to get in touch with me. I'm your regional liaison, and I'm happy to answer any questions offline. And I work closely with Jerome, and so he and I can piggyback on a response to you. Can daycare vehicles? Yep, I see. Daniel. Hi, Daniel. Can daycare vehicles be used to support transportation? From daycare vehicles, I guess, are they funded? Are they Head Start fund? I don't know what daycare vehicles, but my thinking would be yes, if school buses can be, and I guess Daniel, follow up with me and let me know how is that daycare vehicle funded? Is it coming from ACF? Or just like school buses? Yeah, I believe so. I mean, I'm not an attorney and I'm not an expert on insurance and pupil transportation and you know, Head Start vehicles, but I would think the same. I'll find the response that I got from FTA and I'll send it to you, Daniel, because it might say something about Head Start in there. I can't recall, but it might also allude to that, so that will give you some information. And then go to that program inventory, because I believe that some of the funding sources for Head Start are included on the funding inventory, and so that'll let you know whether transportation is covered. So there's my contact information. The other thing is, FTA wants, we are required as a federal technical assistance center to provide an evaluation to FTA about our performance. And so the way we do that is we ask you for information about how we did. So if you would take 2 minutes, it's seriously 2 minutes, it'll take you to complete the survey here. Please do so. And it's anonymous. If you want to include your information, you're welcome to. My understanding is that Olivia is also going to be sending out the recording of this for those that miss it, and she'll also provide the link again. But please, we hope that you take time and give us the feedback, positive and negative. We also learn. And unless there's anything else, I would love to say thank you for all of you for participating and for your interest in this topic. And you, because I know many of you, I know the great work that you do, and I'm so appreciative of the opportunity to continue to work with you. So,
Hey, Judy, this is Paula.
yeah.
So everyone, you're not going to be able to click the link from inside of this presentation. We will be emailing you after it's over so that you have access to the SurveyMonkey. You'll also have access to the presentation and any other supporting materials from Judy.
Okay. Jerome, can you copy and paste the URL into the chat?
Do you have it? Yeah, I should.
If not, I can do it, Judy.
Okay. Okay. And
Jerome,
we'll
I'll do it for
definitely
you.
send it. We'll definitely send it after, but when Paula puts it in there, please copy it and fill it in. That would be great. This is what it looks like. It's a very short survey. I think it's like 8 questions. So thank you. And again, it was great talking with you today. And I hope that if you have anything else, you'll follow up afterwards with me. So
take care.
Take care, everybody.
Thank you.
Bye-bye.